Hi. What is it that we can help you with today? Okay, so you're here for a cranial nerve exam. Okay, perfect. So my name is Madison, and I'm going to be the one who's going to be taking you through the cranial nerve exam today. Can I have your name just so I can check our systems? Yeah? Perfect. And can you just confirm your date of birth, please? Okay, cool, perfect. So what is it that actually brought you here today? Okay, yeah, so sort of like slight headaches. Yeah, is it like a sort of shooting pain or like a dull ache? Okay, and slight dizziness. Bear with me, I'm just going to write that down. Okay, and do you take any medicine at the moment? And is that the only medication that you're on? Okay, and what was that for? Why did they prescribe that to you? So you've been suffering with headaches for quite a while. Okay. Cool. And what about like your eyes? Do you have any problems with your sight or any discomfort, anything like that? Okay, so that's all good. Any like soreness, like sort of, red in the eye? Okay. Do you sit like behind a screen all day? Like, do you work in a job where you have to look at a screen constantly? And then do you come home and sort of sit on your phone as well? Yeah. We are all guilty of it. Okay. So before we start the exam, I just need to quickly take your temperature. Obviously with the circumstances at the moment, it's just one of our rules that we have to do at the moment. So let me just take this out. Okay, so I'm just going to place this under your tongue. And yeah, see what your temperature is and just check that you don't have a fever. So if you just lift your tongue up. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Great. Okay, so your temperature's all fine. That's lovely. So we're just going to begin. I'm just going to put on some of these gloves. They're a little bit tight, apologies. So we're just going to begin by touching gently around your face, just sort of checking for any swelling, anything that feels slightly abnormal, swelling, tenderness, things like that. I'm also just going to check your glands that are in your neck, stuff like that. Apologies. And then we're going to move on to testing some of your other senses just to make sure that everything is okay there. So, if it's okay with you, I'm just going to touch gently around your face, and you just tell me if anything feels uncomfortable or sensitive or not sort of, right, yeah? Is that okay? Perfect. So, just going to sort of begin by touching the forehead a little bit. Okay, that feels fine. And just the sort of temples. Yep, perfect. Okay, yep, and now just the chin as well. And just around here in the cheekbones. Is that all feeling okay? Yeah? Good. And that all feels fine, yeah? Okay, so everything feels normal around here. I'm just going to feel gently under the neck. You have some glands in your neck, so I just want to sort of check they're not swollen or enlarged or anything like that, and just check for any more discomfort around there. Is that all good, yeah? Okay, perfect. And then just sort of under the neck. Okay, that all seems to be fine. So next, I'm just going to quickly take a look into your eyes for me. So, I'm just going to shine a light, just gently, just to see sort of just inside your eye, the whiteness of your eye. I'm just going to gently lift down your eyelid just a tiny bit, just to have a little look inside. Okay? Okay. Okay, good. That all looks normal. And now, just in your other eye. Yep. Yep, and I'm just gonna feel gently on this eyelid a little bit. Okay. That all seems fine. So next, I'm going to shine this light, it is a little bit bright, into each of your eyes alternatively, and basically just see how your pupils dilate and how they react to the light. Okay, so I'm just going to cover this eye, okay, and I'm just going to shine this light in your eye. Okay, good. And again. Perfect. And one more time. Okay, good. I do apologise, it's a little bit bright. And next eye. Ready? Okay. Okay. Perfect. So next, I'm just gonna get you to follow the light with your eyes. I just want to see exactly how, your eyes follow the light. Try not to move your head, okay? Yeah? Cool. So just follow the light with your eyes. Good. Good. Very good. And a tiny bit closer. Okay, and the last thing I'm just going to do with the light is I'm just going to come up close. Just take one look into each eye very quickly and just examine it a little bit closer. Just keep focused on my nose. Okay? Don't look at the light. Good. Perfect. And then quickly into the other eye, and that's all with the light. Perfect. So the next thing that I'm going to do is I'm just going to quickly check your peripheral vision. This is really simple. What you're going to do is you're just going to look at my nose, okay? Don't look anywhere else, just keep staring at my nose. What I'm going to do is I am going to slowly move my fingers apart from each other, and you're basically just going to tell me when they go out of your vision. Yeah? Sound good? Okay. Right, ready? Okay, go. Good. Good. Perfect. Good. Good. Great. One last go. Perfect. So that was easy. I'm just going to quickly write down what I found from this, which to be honest isn't really much. Everything on your face seems normal. Your eyes are quite reactive. So yeah, there's not really much going on. The only thing that I would say is just visually, you can see like slight discoloration of the eye, which is probably just from, you know, where you sit in front of a screen all day. A lot of those blue lights coming into your eyes. So yeah, the only thing I can recommend for that is we could get you some drops prescribed today, or maybe some like blue light glasses. Yeah, so they're basically just like normal glasses, except they don't help with sight. They just kind of look like glass, and they just help block out the harmful blue rays from your screens. So let me just write this down, bear with me 1 second. And would you be interested in the blue light glasses? Because I can give you like a little link of where to get them. Yeah, let me just put that in an email and I'll get it sent across to you after the meeting with all your notes. Okay. Next is a quite simple one. You're just going to close your eyes and we're just going to feel again around your face, and you're just going to tell me, you know, when you can feel me pushing down on your face. It's basically just to sort of see if, you know, you have all your sort of nerves in your face and you can just feel me touching you, so it should be quite a simple task. So I'm just going to lightly press and I'm just going to reduce the pressure every time. Okay, and you just keep telling me. Perfect. Ready? Yep. Good. Perfect. So you have all your senses, which is what I thought. Next. So the next one, again, quite a simple one. We have a couple of different fragrances here. We're just going to be spraying them, and you're going to tell us basically what they smell like. So they're very very obvious smells. They're smells that you should really be very familiar with and recognise near enough straight away. Okay? Cool. So we've got 3 sprays, and yeah, you're just going to tell me which each one is. Perfect. You ready? So I'm just going to spray it just near you but not on you. Ready? Perfect. That is indeed lavender. It's one of my favourite smells. Okay, and the next one. Yes, mint. That is exactly it. Okay, and the last one. Are you ready? Not too sure. Do you want me to do one more? Yeah, perfect. Okay, 1 second. Yes, exactly that. It's like a citrusy thing. Perfect. So let me just write down that you got all those correct. Perfect. Now, we just have a few different flavours here. So this is what one of them looks like. They're just in like a little vial thing. And basically you're just going to stick your tongue out. We're just going to place a drop onto your tongue and you're just going to tell me what each of them is, what flavour each of them is, yeah? Simple enough. Okay, so there's 3 of these as well, so just start with the first one. And just 1 drop, stick your tongue out. What do you think that is? Very easy. It is vanilla. Let me just grab the second bottle. Stick your tongue out. Banana, exactly, well done. And last but not least, tongue out last time. Yeah, mint, exactly that. Do you not like mint? Okay, sorry about that. So that is all for this cranial nerve exam. Yeah, I think we sort of just come to the conclusion that maybe trying to, I guess, reduce your screen time. I know that can be quite hard when you work behind a screen, but maybe just, you know, when you come home, trying to relax your eyes a little bit. I've also prescribed you with a eye drop for sort of dry, tired and irritated eyes. If you just put it in once in the morning and once before bed, and hopefully your eyes should feel a little bit less sore. And also I have written the link down for some blue light glasses, so you know, if you want to purchase them then, you know, you can. Okay, so yeah, that wasn't too bad, was it? No, so if you don't mind, I'm going to schedule you in for 6 months' time, and we can just do another one, check that nothing's changed. Obviously, if anything does change, you can come back before that and we can do another one. But yeah, if everything stays the same, then we'll see you in 6 months. Okay? Okay, thank you. Bye-bye.